Hand injuries are quite common, affecting people of all ages and walks of life. From minor cuts and bruises to more severe fractures, our hands are vulnerable to a variety of injuries. One such injury that often affects the thumb is called a Bennett fracture. This specific type of fracture occurs at the base of the thumb and can significantly impact hand function. This type of fracture can be quite painful and debilitating, making it difficult to perform everyday tasks such as gripping objects, writing, or even using a smartphone. In this comprehensive guide, we will delve deeper into understanding what a Bennett fracture entails, including its anatomical implications and how it affects the thumb's movement and stability. We will explore its causes, which often include falls, sports injuries, and accidents, as well as the symptoms that can help in early identification. Additionally, we will discuss the various treatment options available, ranging from immobilization with a cast to surgical intervention and the road to recovery, which may involve physical therapy and rehabilitation exercises. Whether you're an athlete involved in contact sports or someone who simply wants to learn more about this specific hand injury, understanding Bennett fractures is crucial. This information will provide valuable insights into Bennett fractures, helping you recognize the signs and seek appropriate medical care. Understanding the intricacies of this fracture can empower individuals with the knowledge to seek timely medical attention and facilitate a smoother healing process, ultimately leading to better outcomes. So let's dive in and explore the world of Bennett fractures, equipping you with the knowledge you need to protect your hand health and ensure a swift recovery. A Bennett fracture specifically involves a break at the base of the thumb metacarpal. The metacarpal bone connects your thumb to your wrist. This fracture occurs in the first metacarpal bone, which is responsible for the thumb's movement and stability. What sets a Bennett fracture apart from other thumb fractures is its unique characteristic. The fracture line extends into the carpometacarpal joint. This joint is where the first metacarpal bone meets the trapezium bone in the wrist. The involvement of the joint surface makes Bennett fractures more complex than simple fractures that don't disrupt the joint. Bennett fractures typically occur due to a direct impact or force on the thumb, often when the thumb is extended. Imagine a scenario where you fall and instinctively extend your hand to break the fall. If the impact is forceful enough and concentrated on the base of your thumb, it can lead to a Bennett fracture. Certain activities or situations increase the likelihood of experiencing this type of fracture. Engaging in contact sports like boxing, martial arts, or football, where forceful blows to the hand are common, puts individuals at a higher risk. Additionally, accidents such as a punch to a hard surface or a fall while skiing can also result in a Bennett fracture. Section 4. Recognizing the symptoms. Is it a Bennett fracture? Suspecting a Bennett fracture is possible if you experience certain symptoms following a thumb injury. This type of fracture typically occurs at the base of the thumb, affecting the first metacarpal bone. One of the most telltale signs is immediate pain at the base of the thumb, specifically near the wrist. This pain can be sharp and intense, making it difficult to ignore. This pain tends to intensify when you try to move your thumb or grip something. Everyday tasks like holding a pen or opening a jar can become challenging. In addition to pain, swelling around the base of the thumb and extending into the wrist is common. This swelling can make the thumb appear larger than usual and feel tender to the touch. You may also notice bruising in the area. The bruising can range from mild discoloration to more severe, dark purple marks. Another indication is difficulty moving your thumb, particularly when attempting to pinch or grasp objects. This can significantly impact your ability to perform fine motor tasks. The thumb's range of motion may be limited, and any attempt to move it can exacerbate the pain. This restriction in movement is a key symptom to watch for. Section 5. Treatment and recovery. Getting back on track. When it comes to treating a Bennett fracture, the primary goals are to realign the fractured bone fragments and ensure proper healing while restoring thumb function. This type of fracture, which affects the base of the thumb, can significantly impact hand mobility and strength if not treated properly. The specific treatment approach your doctor recommends will depend on the severity of the fracture and individual patient factors. Factors such as age, activity level, and overall health can influence the treatment plan. For stable fractures with minimal displacement, non-surgical treatment options may suffice. These conservative treatments are often effective in promoting natural healing. This typically involves immobilizing the thumb with a cast or splint for a period of 4 to 6 weeks to allow the bones to heal in their correct position. During this time, it's crucial to follow your doctor's instructions to avoid complications. In cases of displaced fractures or those involving significant joint instability, surgical intervention may be necessary. Surgery is often the best option to ensure proper alignment and stability. Surgery aims to achieve anatomical reduction and stable fixation of the fracture fragments, often using pins, screws, or plates. This helps in maintaining the correct position of the bones during the healing process. Recovery from a Bennett fracture takes time and patience. Physical therapy is often recommended to restore strength and flexibility. Regular follow-up appointments are essential to monitor progress and make any necessary adjustments to the treatment plan.